All right, everyone get ready, because today we are going deep into clinical judgment.
Ooh, clinical judgment.
Yeah, in nursing.
Okay,
And we've got some excerpts from a nursing textbook to help guide us.
cool.
And we're going to unpack how nurses make those like split-second decisions, the ones that can really make a difference for patients.
It's like they're detectives almost.
Right.
You have to use all their knowledge and their experience to figure out,
Yeah, they're solving a mystery.
to solve patient care mystery.
I like that. I like that a lot.
Yeah.
But before we get into all those little details,
Yeah.
let's kind of start back at the beginning.
Okay.
What exactly is clinical judgment?
So the National Council of State Boards of Nursing, they define it as the visible outcome of critical thinking and decision making.
Okay.
But I think what that really boils down to is that nurses are constantly assessing and prioritizing and then choosing the best course of action.
So it's not just like blindly following a checklist.
No.
They're actually really using their brains to figure out what's going on
Right. It's problem solving in action.
with the patient and how to help them.
And this is one of the things that really sets registered nurses apart from other healthcare providers.
Okay, how so?
Well, you think about it, like, let's say a patient's condition starts changing. A technician might notice that something's different.
Right.
But a registered nurse, they're trained to analyze those changes and recognize potential problems and then take action to address those problems.
So it's that ability to like connect the dots
Yeah,
and make an informed decision.
right. It's crucial.
That's huge.
It is.
When you really think about it, that's a lot of responsibility on
Yeah.
your shoulders.
And it makes you appreciate all those great nurses out there who have taken care of you or your loved ones.
Definitely, yeah.
Now, you might be surprised to hear that experience often matters even more than objective data alone.
Really? So you're telling me that a nurse's gut feeling can sometimes be more important than like cold, hard facts?
Well, it's not just a gut feeling.
Okay.
It's more like pattern recognition
Okay.
that develops as nurses gain experience.
Gotcha.
Dr. Christine Tanner, she's a nurse researcher,
Okay.
and her research shows that experienced nurses, they really have this amazing ability to interpret data based on things they've seen before.
Interesting.
Like, for example, they might know that a certain patient tends to have a particular reaction to a medication, even if the current data doesn't immediately suggest that that's going to happen.
So they're kind of drawing from this like internal database almost.
Yes,
Of
exactly.
patient responses.
Yeah.
That's fascinating.
And actually building on that, Dr. Tanner also emphasized how important it is to really know the patient.
Okay.
And I don't just mean like their medical history, but understanding their lifestyle, their concerns, their support system.
It's that whole person approach.
Yes,
It's
exactly.
not just looking at a chart.
It's treating the whole person, not just a collection of symptoms. And this is a big part of patient-centered care, tailoring treatment plans to an individual's needs and preferences.
Okay, so we've got experience, we've got knowing the patient. What else comes into play when nurses are making these clinical judgments?
Well, the environment matters too.
Oh, yeah, the context.
Right, the context of the situation.
That makes sense because a nurse working in a busy ER
Right.
is going to be facing different challenges than a nurse at like a small rural clinic.
Absolutely. The culture of the hospital or the unit, the resources that are available,
Yeah.
even things like time constraints, those all make a difference.
So it's almost like every situation is this unique puzzle
Yes.
that a nurse has to solve.
And here's another thing. Nurses don't just rely on one way of thinking.
Right.
It's more like a combination of problem solving, reflection, intuition.
You're pulling out all the tools.
It's a whole toolkit of approaches.
Totally.
Figure out the best course of action for each patient.
That's incredible. When you think about it, they're constantly adapting and thinking on their feet.
They are.
But how do they even begin to like organize all that information
Right.
and make sense of it?
Well, that's where this thing called the clinical judgment model comes in. It's
Great.
kind of a framework that helps us understand all the elements that go into making those critical decisions.
Gotcha.
There are 4 key components they highlight in this model. The nurse's knowledge base,
Okay.
their experience, the environment, and then their critical thinking attitudes and standards.
So is it kind of like a mental checklist?
Not exactly a checklist,
Okay.
more like a mental roadmap.
Okay, guide.
Yeah, it helps guide their thinking.
Okay.
Think about it this way. You have 2 patients coming in with difficulty breathing.
Okay.
One has pneumonia, the other has fractured ribs.
Uh-huh.
They're presenting kind of similarly, right?
Yeah.
But using the model, a nurse can look at each patient's unique situation, their medical history, all these other factors.
And come up with very different care plans.
Exactly.
Even though the initial complaint might be similar.
Right.
the underlying causes and the appropriate responses could be totally different.
Exactly.
This model's pretty powerful.
It is. And you know what? As nurses gain experience applying the model, it starts to become more intuitive,
Oh, wow.
almost like second nature.
Like they don't have to think through all the steps every time.
Yeah, they're not consciously going through each step.
It's just informing their decisions.
Right.
Wow, that's amazing.
But I think it would be helpful to see this in action.
Yeah, can we see an example?
Sure, the textbook actually gives a great case study
Oh, perfect.
about a patient named Mr. Lawson who's recovering from abdominal surgery.
Okay,
So let's dive into that
I'm ready.
and see how his nurse, Tanya, uses her clinical judgment skills.
Let's do it. So Mr. Lawson, he's recovering from abdominal surgery,
Right.
and Tanya is his nurse.
Yes.
How does she use that clinical judgment model to care for him?
Well, she starts by noticing that he's in a lot of pain
Yeah.
and having trouble moving around. So she gathers information, she checks his wound, asks him about his pain level, reviews his chart.
She's really taking the time to assess everything.
Right, not just jumping to conclusions.
Yeah.
And then she analyzes all that information.
Okay.
And she knows that pain can really impact a patient's ability to move around.
Right.
And she also knows that if someone's not moving around after surgery,
Uh-oh.
that can lead to problems like blood clots.
Yeah.
So she's connecting those dots.
She's seeing the bigger picture.
Right.
Yeah.
And based on all of that, she makes the judgment to prioritize pain management
Okay.
because she knows that if she can get his pain under control,
Yeah.
he'll be more likely to start moving around,
It all comes back to that.
and that will reduce his risk of complications.
So it's like a domino effect.
Yeah.
You take care of the pain.
Yeah.
You improve mobility. And then hopefully you prevent any other problems from popping up.
Exactly. And this is a perfect example of how the clinical judgment model guides a nurse's actions. She assessed Mr. Lawson's situation, considered her knowledge and experience, factored in the whole context of his recovery,
Right.
and then used her critical thinking skills to come up with a plan.
I think what's interesting is that she's not just like following a set of orders
Right.
or protocols. She's really using her judgment
Yes.
to make decisions in Mr. Lawson's best interest.
That's the core of clinical judgment, individualizing care,
Yeah.
responding to the patient's needs.
And it's ongoing, too.
Oh, absolutely.
It's not just a one-time thing.
It's constant assessment, analysis, adjustment
Makes me think about all the decisions nurses are making
all day long.
all the time, not just in these big dramatic situations.
Right. Like think about a nurse caring for a patient after a heart attack.
Okay.
They're monitoring vital signs, looking for any signs of complications,
Yeah.
making sure meds are given correctly. Every little piece of information they get, they're making decisions.
Oh, wow.
Does something need to change? Should I call the doctor?
It's a lot. They're like playing mental chess, always thinking a few steps ahead
That's a great way to put it.
to prevent problems.
And it's not always easy, You've got time pressure, limited resources. Sometimes patients have really complex conditions.
Especially in like a busy ER ICU.
Exactly. Things are constantly changing.
You have to make fast decisions with limited information.
It's a lot to handle
How do nurses develop that ability?
to make good judgments under pressure.
Yeah, is it just something you're born with or is it learned?
I think it's a little bit of both.
Okay.
Some people might be naturally inclined to think that way,
Uh-huh.
but it's definitely a skill that you develop
Through training and experience.
through education, through experience, mentorship.
Like any skill, the more you practice, the better you get.
Exactly. Nursing school gives you a foundation,
Yeah.
but you really sharpen those skills out in the real world.
Working with real patients.
Right. And having good mentors is so helpful
Yeah, to bounce ideas off of.
to learn from those who've been there.
Makes you realize how complex nursing really is.
It is.
It's so much more than just following orders.
It's about using your brain and your heart
Yeah.
to advocate for your patients.
It's both intellectual and compassionate.
It is. And you know what I find really fascinating?
What's that?
These principles of clinical judgment,
Uh-huh.
they can apply to so many areas of life,
Oh, totally.
not just healthcare.
We could all use a little more critical thinking.
Exactly.
So how can people boost their critical thinking skills?
Well, first of all, be curious.
Okay.
Ask questions.
Mm-hmm.
Challenge things. Don't be afraid to dig deeper.
Yeah.
Don't take information at face value.
Oh, that's a good one.
Think about the source, look for biases, and find evidence.
And then reflect on your decisions.
Yes, reflection is key for improvement.
Yeah. How did I make that decision? What could I have done differently?
It helps you grow.
So for our listeners, Think about a recent decision you made.
Okay.
How did you approach it? What factors did you consider?
Good question.
And looking back, what would you change
That's a great exercise.
to apply these ideas?
Yeah,
All right, we've covered a lot today.
we have.
What clinical judgment is, how it works, how it's used in nursing.
Right.
But there's one more piece.
Yes, one crucial aspect we haven't talked about yet.
Okay.
The potential challenges.
Ooh.
The pitfalls that nurses can face.
When making these tough judgments.
Yeah, it's not always smooth sailing.
All right, I'm ready to dive into that. Okay, so we know nurses use all that knowledge and experience to make clinical judgments.
Right.
But what are some of the challenges they face?
Yeah, you hinted that it's not always easy.
It's not always a straightforward path. right?
No, even with the best training, there are situations that can really complicate things.
Like what? What kinds of situations?
Well, one common challenge is dealing with patients who don't respond the way you'd expect.
Okay.
You could have two patients with the same condition getting the same treatment,
Huh.
but they might react in completely different ways.
Right, because everyone's body is different.
Exactly. It's not one size fits all.
So what does a nurse do then when they see those unexpected responses?
Well, the first thing is to reassess the situation.
All right.
Gather more information, check vital signs, see if anything's changed.
So it's like back to square one
Kinda. Got to get more data.
to make a better decision.
Right. And they often have to talk to other members of the healthcare team, too.
Like the doctor?
Yeah, the physician, the pharmacist, get everyone's input.
It takes a village.
It really does.
You can't make these decisions in isolation.
Teamwork is so important in nursing.
Definitely, especially in those tough situations.
Absolutely.
What about technology? How does all the new tech play into clinical judgment?
That's a great question. Technology has really changed things.
It has.
I mean, it gives nurses access to so much information now.
Like what?
Electronic health records, research databases, even tools that help with decision-making,
It's like having a whole library
and a supercomputer all at once.
at your fingertips. That's got to make things easier, right?
In some ways, yes, but it also adds new challenges.
How so?
Well, nurses have to be able to filter through all that information,
Right.
figure out what's actually reliable and relevant,
Okay.
and then apply it to their patient.
That makes sense. It's not just about having the data.
No, you have to know how to use it.
It's about understanding it.
And of course, technology can't replace critical thinking.
Or the human touch.
Exactly. It's just a tool.
A powerful tool.
But still just a tool.
Right. You still need that human element.
And that's what makes nursing so special.
Yeah.
It's that combination of knowledge, experience, compassion,
It's making a real difference in people's lives.
and sometimes making really tough calls.
Well, this has been really eye-opening.
It has.
We've learned so much about clinical judgment,
How complex it is.
how important it is
It's a skill that you keep developing.
throughout your career.
It's a journey.
So to everyone listening, next time you see a nurse,
Take a moment
to thank them.
for all they do.
It's amazing work.
It really,
And remember, those principles of clinical judgment
they apply to all of us.
in every part of life.
So stay curious
Keep learning.
and never stop asking questions.
Great advice. Thanks for joining us
Thanks for having me
for this deep dive into the world of clinical judgment.
in nursing
We'll see you next time for another fascinating exploration.
of knowledge.
Bye, everyone.